Right. Dr. Rice, looking for ready. Okay. Wonderful. Okay. It is time to call our meeting to order. We'll begin with roll call. Shelley? Amber Rice? Present. Brian Smith? Present. Mr. Key? Jason Johnson? Chris Rommel? Long? Christina Long?
Here.
Matt Shaw?
Present.
Orlando Alvarado? Yeah. Ryan Harold? Sandy Nygaard? Here. Phoebe Merrill?
Present.
Troy Hogue?
Present.
All right, thank you, Shelley. I'll begin with the chairman's report. The attendance report is attached in your packet here. It's 3A. And just a reminder, it is really important that folks from the committee do attend these meetings. And the Bureau will actually reach out to you if you miss 2 or more consecutive meetings, and they will ask if you're still interested in serving on the committee. Next, for the vacancy report, there are no current vacancies. Moving on to the Bureau report. Chief Clerk, yes.
All right. Good morning, Dr. Wright. And committee members, we do have some slide tee-ups to share with you all. And I will not go through all of the slides this morning. We really just wanted to make sure that we had a slide deck to share that gave some of the summary of information that we're going through today on a wide variety of items. So really quickly, our first 2 slides are an overview of our fiscal year 2024 appropriation. And you can keep going, Shelley, to the next one. And some of our activities. This year, we were appropriated $1.1 million at the Bureau of EMS and Trauma System. We are sliding out of that budget about $850,000 that is going to the EMS Regional Council. We're really fortunate because the EMS Regional Councils have taken on a little bit more work over the last year. And thank you very much, because we had $100,000 per region that is being dedicated toward rural paramedic education in each region. We expected that we would probably get about 10 rural paramedics per region to go through classes over the last year. And correct me on this one, Brian, did you say 76 in the northern region alone? That's phenomenal. So we're really pleased with that, and we hope that we can continue to dedicate that funding, especially to education across the state. This is a snapshot of the EMS and trauma systems here in Arizona. To focus on workforce for a moment, there are over 21,000 EMCPs certified in the state of Arizona. That includes 8,361 paramedics. And TJ, correct me if I'm wrong, we have 65 certified training centers across the state as well that support that work and building up that support.
Just bump that up 3 more to 68.
68. That is great news. So thank you very much. Big thanks also to all the team members in the room that and all the agencies that contribute to the system that we see highlighted here on the screen. A couple more slides. I won't go through in great detail because there's some other agenda items that will elaborate on them, but we do have some national registry updates, and TJ is on the line. So TJ, can you please give a report on this for the group?
I can. I'll try and make it very quick, but I also wanted to thank Josh Tilton from National Registry for attending this morning. He's available if anyone has any specific questions for him, and I'm sure he'll be able to provide his contact information in the chat if you have something you want to reach out to him after the meeting for. But very quickly, we had a stakeholder meeting recently where National Registry is revamping facets of their website. You're going to get a little bit different information on the training program and state officials landing page on their website with a lot of really useful information that should be very helpful. The BLS practice analysis is ongoing, started about a year ago, and it's checking the knowledge, skills, and abilities of the BLS practitioners to help improve the quality of testing moving forward. They've also introduced a scaled reporting report for students who are unsuccessful in taking their national registry examination, and this is going to give them a unique score that basically allows candidates to see exactly how they performed in comparison to what it takes to be successful, so that they can improve their chances with subsequent attempts. ALS psychomotor assessment is ongoing. Again, it's going to introduce scenario-based items and questions on the computer-based test. They've focused a lot on clinical judgment, and the pilot testing for that program started about a year ago. It's going to launch in July 1st of 2024, and they'll begin phasing out and sunsetting the psychomotor exam for registry, and that will be ended by June 30th of 25 under the current schedule. The AEMT, they're starting some evaluation and some voluntary accreditation with COAIMS. They're working on that stuff right now. We've got key initiatives on there. There's a link to those, which includes all the items I just mentioned, as well as an increased use or adoption of the EMS ID. It's a national ID that everybody gets when they are certified. Also went back and they grandfathered in those who didn't have national registry, created an ID for them. So everyone moving forward, everyone currently in the field should have one that they can use for tracking their continuing education and certification, especially those who cross state lines. In addition to that, they've got the evolution of the NCCP. It's ongoing. That's a National Continued Competency Program. And effectively what they're doing is keeping the same number of hours that are required in CE topics, but they are shuffling the number of hours within the individual topic. So that's going to go into effect in 2025 for the individuals who'll be expiring in March of 26. Board meetings, that's for the current resolutions. These are the ones that are from April and June of 2023. The comment period for resolutions 1, 2, 3, and 4 close on August 8th. And that's dealing with the evidence-based guidelines for testing, updates and framework for the NCCP, the AAMT minimum competencies that go along with the voluntary accreditation, and then approving the BLS practice analysis that's going on. If you have any questions for me, please don't hesitate to reach out. And Josh, is there anything that you wanted to specifically mention?
No, I think you did a great job of covering that, TJ. Thank you.
Perfect. Thank you. If anyone has any questions, please don't hesitate to reach out.
Thank you, TJ. Thank you, Josh. Appreciate all the updates on National Registry. We have a couple more slides on the SHARE program as well as naloxone leave behind. Dr. Bradley, would you like to cover these now, and then we'll go through the rest of the slides?
Sure. So just a little bit of an update about the SHARE program. As we've mentioned previously, the data component of SHARE, which was previously housed under the University of Arizona, has transitioned over to the Bureau as of July 1st. From the EMS agency perspective, there should be no changes. The data still gets imported into AD peers as previously. The big change is really for the hospital. The only change will be really who houses that data. We are in the process of still converting that all over. All the hospitals who are cardiac receiving or referral centers were notified this week of that change. There is a slight pause of being able to adjust any record. Sometimes hospitals like to go in and change record. We have a pause on that, but you can still continue to import all of your cardiac arrest data from the hospital side. From the CHEPI committee, we will be having a SHARE registry users group meeting. We anticipate sometime in the fall. We really want to look and reevaluate the SHARE report that each of these guys get feedback from the group and see what we can do to potentially improve or alter that report moving forward. Boxel and her team have been spending quite a bit of time really working with the University of Arizona on that data transition. And we are also in the process of hiring 2 additional epidemiologists to help with the data component. So the point of contact, if you have questions, are going to be Julie Benton and Adam Rodriguez. Both of their contact information is on the slide for you. So please let us know if you have any questions. But we will continue to share this message. We recognize that SHARE has really made Arizona the leader in out-of-hospital cardiac arrest, you know, for the last almost 20 years now, and we want to continue with this program and really kind of work on the next steps to improve outcomes from cardiac arrest. Any questions regarding that? All right, next slide, Shelley. Thank you. And next is the naloxone leave behind. We are at the point now where we are live with the training. So the training curriculum is live. We have several agencies that have already started putting that training out to their personnel. The goal is for your agency, once you say you would like to participate, you will get the link to do the training. You can then upload that directly to your learning management system. In order to get the actual naloxone kits, we do ask that you have 80% of your personnel complete the training. And then we will have the kits available. You can see on the slide here, there's a picture of what the kit itself looks like. Inside the kit, there will be a box with the 2 doses of intranasal naloxone, which are 4 milligrams each, as well as 2 resource cards. The 1 resource card will help individuals identify an overdose and how to use the intranasal naloxone. And the second will be a resource guide for patients who are interested in any resources for substance use disorder. Those are customized to your geographic area. So we want to make sure that when someone gets a resource guide in Northern Arizona that is specific to that area, as opposed to just statewide resources. So the last piece on the kit will be a QR code sticker. Because this is grant funded, we do have to collect the basic data elements. The QR sticker will be removed, and essentially we just ask when you hand out the kit, you just scan the QR code and put in 1 or 2 data elements, and that will complete the data requirement. So really, this is not something that's going to be a big data input for the end user. We want to make this as really easy as possible for the agency to implement. We had a really good meeting with the county as well here this week, where I think a lot of cities and jurisdictions have received some of the opioid settlement dollars and are looking to support some of the programs out there. So that is a highlight. If you have any questions, Sebastian Thomas is the point of contact for that. You can see his email on there as well. And I know you put that in the chat the last time, so I'm sure you will again.
She dropped it in there now.
Any questions about that? Thank you very much.
Program. Okay, I just have a couple more slides. If we keep rolling, we do have updated EMS and trauma dashboards. The links to our dashboards are in these slides for folks that are looking for more information. We're really proud of the most recent update that the team has worked on with various committees and stakeholders to really give that high-level overview of the EMS system across the state. What we see here is an EMS system snapshot. We also have dashboards on trauma. We also have dashboards on response times for awareness. Moving to the next slide, we want to make everybody aware we are seeking feedback from trauma centers to help improve the Arizona Trauma Registry system. The quick overview is before the department goes out to RFP, likely at the end of September, we are seeking input from trauma centers on how we can help improve the trauma registry over time. Next slide. And can we skip ahead, Shelley, to 16, slide 16? Really quickly, because this group is focused on education, I want to do a quick plug for the EMS and trauma portal. A big initiative for the department over the last year was we updated our EMS and trauma portal at the website that you all know and love because so many of the stakeholders use it every couple of years, right? As we have launched this portal, we have been very excited to learn about image trend features that allow providers or agencies to log into the system, update their rosters, and issue cards for all of their EMTs. It's a cool feature for the agency because you can see everyone and you can get access to their cards. It's a cool feature for the state because now we are going to have, as every agency comes online and does this, now we're going to have access to workforce metrics across the state. Previously, the 21,000 EMTs in our system, we didn't truly know if they were all actively working or not. Now, as all the agencies come online and update their rosters, we are going to have insights into how many folks are actively employed by EMS agencies across the state. This is going to be tremendous data for us and going to help drive the work of some of these committees moving forward as we think about the future of the EMS and trauma system in the state. I think the next slide is just a plug of how you can go into the system. It's somewhat mobile friendly, desktop browsers preferred. There's QR codes that link right to the EMCP information on the website and lots of cool video tutorials on the website. I think they're like 60, 90-second blurbs on how to go in and update your agency. rosters and generate those cards. That is all I have for now. You got anything?
I was just gonna add, one of the features that comes up a lot at the national level is how many EMTs and paramedics do you have employed in the state of Arizona? And really, we haven't been able to answer that in regards to just people who are certified doesn't necessarily mean that they're working in the pre-hospital setting. When you look at different grant opportunities and funding sources, demonstrating the workforce shortage, we can really demonstrate that, while we have 21,000 certified, what numbers are actually working. I think that's really important data moving forward as we look to figure out how we can bring additional workforce personnel in, because we're hearing that throughout the state that there is such an issue with workforce shortages. So hopefully with this new feature, we will really be able to gather better data for that.
Does that also track the ability, have the ability to track those paramedics and EMTs that are working in hospitals?
It does give us the ability to collect more information than we have previously. We have not pushed out info to those groups though to try to capture that better yet. So far, the tutorials we have are aimed at EMS agents updating their rosters. Thanks.
Right.
Any word yet on tying actions to when I look up certifications?
I heard that it was turned on. It was that image trying to set a crystal button. And so if there's anything that you're not seeing that we need to verify, we can double back on that.
Do you know when that was? Because I've looked at somebody who I know has an action and it didn't show up. That was probably like Monday, maybe.
Let's circle back on that then and see if there's anything we need to look at.
That regards to folks that would have this like a suspension on there, like that what you're talking about, Brian?
But an action like probation or decrease of censures and all those kinds of things on there.
So that has been turned on, you said?
It should be, but I'll look into it to make sure that we're not missing something. Yep. Okay, well, thank you for bringing that. Yes. It's been a process implementing that system, and we're really excited to be able to look at some of that data and information with you all moving forward. I think that's all we have for now until we come up on the next agenda item.
Perfect. Okay, thank you very much.
Oh, wait, can I interrupt one more time?
Absolutely.
I had a note in front of me. I would like to also acknowledge Adam Rodriguez, who's with us today. Adam has recently accepted a new position within the Bureau. Everyone knows Adam because he is our EMS for Children coordinator. He has recently accepted a promotion as our time-sensitive illness and injury manager, taking on more roles with overseeing grants and many programs. And we are just thrilled that you're sharing your expertise with the state, and we look forward to continuing to work with you, Adam.
Thank you. Appreciate that.
All right, so with the Bureau report finished, we will move on to our actual discussion and action item. So the first one I have is to discuss the minute, approve the draft minute for March of 2023. So could I have a motion to discuss?
So moved.
First, do we have a second? Did you get a second? Not yet. Does anyone want to second the motion?
This is Matt. I'll second it.
Thank you, Matt. All right, so looking over the minutes that Shelley has displayed on the screen here, also attached in your packet. If anyone has any discussion or amendment to make, please let us know. Have a moment to review it. Okay, so it looks like Shelley has reached the end of it. If there are no comments, we have just a moment more. Okay, we'll move to a vote. All in favor, say aye.
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 Any opposed, say nay. And are there any abstentions? All right, motion passes. The next action item is to discuss the next steps for EMS and trauma needs assessment and workforce needs survey. And so this one is Julia.
Good morning, everyone. So next step for the EMS and trauma needs assessment. So far, we have conducted our individual and organization survey assessment. Thank you to everyone who has participated. For the individual assessment, we got over 1,100 responses, which is great. And for the organization assessment, we received 99 responses. So that was from EMS agencies and hospitals and training centers primarily. So the next steps for this process will be to look at some of the survey data that we have compiled. We like to host stakeholder focus groups. So we will be coming to each of the, or we plan to come to each of the regional councils, as well as meet with some other groups to really get some input on some of the survey responses and then identify any gaps that there might have been in order to develop the statewide plan. So the plan is for the plans to be implemented in January 2025. So it'll be a 5-year plan, and we're really just hoping to get input. So stay tuned for stakeholder work groups in the future so that we gather input there.
Okay, any comments or questions for Julia? Okay, moving on to fees. I would like to take a motion to discuss, amend, and approve forming a work group for fall prevention and mitigation training to hide fall with hip fracture call volume. Do you have anything on this one? Oh, yeah. Do we have a motion to discuss this one?
Oh, second.
Thank you, Cindy. Any breaths?
So I will kind of give the bug that changed from staff to this committee. So I know this was on the last agenda and the group decided not to create the training at that point. There was really great data that Boston had prepared and shared regarding broad level falls and hip fractures. And we've had some presentations from the Fall Coalition as well. And so the action step was once again to look and see would the education committee be interested in creating some type of training on fall prevention and education. There are some really good resources out there. The Fall Coalition has some training that they've done. But the staff just wanted to put that out there as, again, a request to this committee, recognizing the high morbidity associated with these injuries and the fact that, as we see from the data that we have shared earlier, these numbers keep increasing on a year-over-year basis. So that is a little bit of as a background as to why this is coming back to the committee to consider.
Is there any further discussion on this topic? I know the last time, I'm trying to remember what the discussion was on this one. I think the big question would be whether or not this is something that we saw there would be. I think there's obviously a need for training in fall prevention, whether it be uptake and using the training in this format. I think that's one question I would have. If folks think that agencies would utilize the training, I think there may be no reason to maybe take the time to put it together. I think my concern would be the utilization would be lower, but.
So is the goal to provide that to agencies who go out and do fall prevention mitigation somehow out there, or what's the kind of the target audience? I'm not sure I exactly understand what the.
So a lot of the training out there is just things that crews see on a regular 911 call and typical just minor fall injury type patients, and things where just identifying things like, you know, you tripped on this area right next to your bed or in the bathroom. Okay, can we consider rolling this up and moving this out the way? Just some basic interventions, being aware of when you're doing a lot of these calls, what are some things that you could do in real time for education or to prevent the recurrent fall from these places. They're not going out like on a, you know, pre-scheduled type thing, but really more of a real time. Similar to the safe sleep education that was put together with PACES and education committee as well. It's when you see these things that you realize a safety component to it, address in real time. I think EMS does a lot of this. You should think about many times EMS agencies go on a medical call, they'll hear a smoke detector chirping and they'll say, hey, can we help replace that battery? Again, these are kind of some of those prevention things. So I EMS prevention, just similar to fire prevention. There's EMS prevention, that minor things that can be done in real time.
I think personally, I think it's probably a good thing we do. And I think it would be, there's so many resources out there that we can pull from, so we can draw from those resources. So I don't think it would be a tremendous amount of work on our part. Perhaps this is maybe not put me about the training, but be a resource center for the training that's already available. It's the number one injury. If you don't, I mean, when you think about it, it's absolutely the number one injury. And I think it's valuable to be able to give our pre-hospital people some information to be able to give to the people that they're responding on. And September is also the fall prevention month, so.
But the trauma center is all levels. This is kind of sort of like Kim's nodding her
Yeah,
head.
I was debating whether or not to say anything. I was like, people are probably already tired of me saying it, but yeah, this would be a good opportunity for the level 4 trauma centers that ground level fall is their main mechanism, and they are limited funds wise as far, they've already have this kind of thing ready to go.
Or their EMS agencies, you mean?
Part of the level 4 is that they are providing injury prevention that is targeted toward their main population and mechanism. So ground level fall prevention for their communities would definitely count. Like within literature, hosting these training for their agencies, all of that.
It's not necessarily that that the level 4s are training the pre-hospital provider.
Right.
They're more or less giving information out. I mean, that's what we're looking, at our hospital, we're kind of looking at doing a program involving our pre-hospital partners to be able to go into the home where they've had multiple calls for falls, just to assess and see what's happening. So, I know we do have good fall information.
Yeah.
Material. Maybe we should be a resource for that and be able to say, here you can go to.
Yeah, it sounds like the request is for more community level education though than EMS provider education from the hospitals. I mean, I just wonder if DAB creating community education for the hospital is a better place for this request.
Well, part of the for meeting that requirement is the collaboration. It doesn't have to be independent. So I was thinking more that to be able to collaboration, they would be able to collaborate with EMS to hit those groups.
Yeah, I mean, I certainly think that folks from this committee may be interested in working on a work group with DAB. I just don't know if this is a primarily EMS education or primarily a hospital and community education program, which sort of falls a little bit outside the traditional scope of the education committee. I don't know.
Yes, that definitely doesn't do any type of educational work group. So this would be really focused on the EMS component of it specifically, and then the level 4 should work with EMS agencies in those smaller areas to help support some of that training.
Got it. Okay. I haven't had a motion put forward yet, so I don't know if anyone has a motion related to this at all. I've had some discussion. Obviously, we welcome other comments as well.
Nothing online.
Any suggestions for collaboration with staff to support education that could be used? I haven't heard a motion. Or is this something we
I
want to?
made a motion to discuss amend and approve forming a work group. That was the motion, but
That is the motion on
Yeah.
the table. So
So, yeah.
either you can take a vote to either be opposed or in favor or opposed or.
Forming a work group? Okay, yeah, I guess we can move to vote then. So the motion would be to form the work group. This is the motion on the table currently. So, anyone in favor, say aye. Aye.
Yes,
Aye.
Aye.
Want to do a roll call for this one, Shelley, maybe, or it's?
Again. Amber, right? Do you want to approve the work group?
Aye.
Brian Smith,
I
Esther Key's not here. Jason Johnson's not here. Chris Ronald. How do you vote to approve a work group for the
Yes, aye. Sorry about that.
Chris Long?
Aye.
Matt Scott?
Aye.
Orlando?
Aye.
Under Sandy? Aye. Aaron Hollingford, are you on?
Yes, ma'am, I'm on. Yes, I approve.
Phoebe? Phoebe Merrill? You on? Troy Hope?
Aye.
Great. Thank you all. For those that are interested in being part of the work group, please send your information and let Shelley know so that we can set up a time, and I'll work with whoever members of this group, and we'll reach out to staff as well for a collaborative meeting.
Okay, just for the record, it won't be with staff.
Oh,
We'll have to wait until staff convene.
Oh, okay.
Yeah, this is just a request from staff. The education committee does it.
Got it.
Yeah.
But can other people outside the education committee be on the work group though?
Yes, absolutely.
Okay, okay.
Would you like to talk where we approve material?
Yeah, I believe so. I think it'd be developing materials. All right, moving on. Next one is discuss, amend, and approve draft update to the bylaws. Do I have a motion to discuss the bylaws? Second. Wonderful. Okay, so first of all, we'll run through some of the minor changes similar to the last meeting. There's a couple of things. Moving on to members, the bylaws work group that worked on this one wanted to add the two sort of newer standing members that we have been including on the committee. So the NAMST position and the cases member on the committee. So sort of just formalizing those positions on the roster.
Would we be changing the designations that are on that?
No, it's already on the posted roster as that. Okay. We just didn't have them in the bylaw as that. Thanks. The next one is related to open meeting laws. You want to discuss this at all, Shelley, or do you have anything more of there?
This was my suggestion, just to lay out, but more clear what board members are asked to do when they join the board.
We just wanted to add this to the bylaws. We're you'll hear this at the next two meetings if you attend those as well. As part of the open meeting laws, we are required to follow what's in statute, which is that any member of the committee take these required courses. So we've had a couple members in the committee that have just not wanted to take these courses, and we needed to stay in compliance. That's why we wanted to add it to the bylaws so that expectation is very clear.
Yeah. In addition to that, in the prior meeting, there was some verbiage that was suggested to make clear that to be present in the meeting, that you would have to be either present in person, come off your microphone, or at least make your presence known in the chat so that we can accurately check who's actually present at the meeting. I think that we had added verbiage in the last meeting to that effect, and I would suggest that we add that to this as well, just so that we remain consistent across the board. Section 4, voting by email should not be authorized. That's again in the same vein of these meeting laws. Below, if you go to the officer's position, I'm trying to remember.
That's what my suggestion.
Yeah.
Well, we struggle to follow how it's outlined in the bylaw due to volunteer constraint.
Yeah, it just sort of outlines what in practice is done when we need to appoint new officers. So you can read that section there. Specific to this committee, there are in the motion section, all motions passed by the standing committee was suggested to add, except for educational contents, as we typically aren't forwarded to all of the statutory councils, just to make it clear.
And then just to add that, really for that, it's a way to make this more readily available once the education gets completed and approved. If we have to wait until it goes to the statutory council, we would not be able to post that education until like 3 months later, essentially.
Yeah.
Or 2 months later.
Yeah. And then in the last section, another suggested addition related to authorizing work groups by the committee. Similar to what was added in the other bylaws. So are there any questions, additional discussion, other issues? All right, wonderful. I will then move on to a vote on this item. So all in favor of the changes outlined here and discussed today, say aye.
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 Are there any opposed? Say nay. And are there any abstentions? Motion passes. Moving on to item E, which is to discuss the minute approve forming a work group as cases members to update a draft training on pediatric seizure management. Do I have a motion to discuss the minute and approve this item?
So moved.
Seconded.
Thank you, Matt.
And I can maybe give a little bit of background on this. So PACES has been working now for a while on developing some training for pediatric seizure management. And when I had come to this committee, there was some back and forth between the two different committees regarding some recommendations about evidence-based guidelines and making sure that we're consistent. And so moving forward, the ask is going to be for PACES that if they have topics that they would like training created on, that they bring that to the education committee, and that education committee, if they approve forming that educational module, they'll kind of house that work group with PACES members participating as well. I think this group has done an amazing job with developing the training and educational curriculum and PowerPoints that we have on the website. And really these are geared towards EMS. PACES is a wonderful committee, but they don't have as much of the EMS involvement. And so we want to make sure that the training that is produced is really specific to EMS and matches our TTTGs. So that's why kind of the ask moving forward, rather than going back and forth between the two committees, because PACES is later in the afternoon. Each time we give suggestion, it's not on their agenda and it comes in 4 months later. And so we're hoping this will make this a little more streamlined for everyone.
Yeah, and in the last discussion, there was definitely some interest amongst members of this committee for that work group. So just to throw that out there, that at least the last time around, there was interest in working with PACES on it. So any discussion? All right, with no additional discussion, I'll move to a vote on this item. All in favor of forming a work group for pediatric seizure management with PACES, say aye.
Aye.
Are there any opposed? Say nay. And are there any abstentions? Motion passes. Moving on to F. This is a standing item that we have on this for discussion to review the list of training modules and approve forming a work group to update or create material as needed. So do I have a motion to discuss? Okay, great. Thank you, guys. So here's our list. It's in your group of attachments. I think for this one, the idea would be that the work group could continue to work on the list without having to bring this every single time as a standing item and discuss it amongst the whole committee, but bring recommendations from the work group back to the committee about this list and training and organizing priorities and when content should be reviewed and so forth. Any discussion on this?
I had a question from the bureau side. We have two naloxone leave behind training. One is posted on the tile for independent study. Another is posted on naloxone tile. I was wondering if you still want both.
So what Shelley is referring to, there was the original naloxone training that was designed for EMTs, and that this committee had developed. But as part of the grant for the naloxone leave behind program, there is a newer version, which is pretty similar, but it's just updated and in a different format. The new version is in a learning management system format. So it's something you would upload to your learning management system to provide the training. So the question is just asking, do we want to keep those trainings up there? We just didn't want there to be some confusion if someone wants to sign up for the naloxone leave behind. If they do the old version, that does not qualify. Part of the grant is we have to demonstrate that you're doing the training. And so we do need people to complete the one that's in the learning management system. So that's why we just wanted to ask if the group feels strongly about keeping the old version just as an option. We certainly can, but we want to make sure there's no confusion moving forward for any agencies that want to do naloxone leave behind.
Yeah, it also requires the committee to update multiple modules for the same topic if we keep them both.
Yeah, it would seem to make sense to just have the one.
We just didn't want to unilaterally take that down without bringing that towards the committee. So the committee created the original.
I don't think that requires the vote. Correct? Remove that. I don't.
It could be an administrative change.
Okay. We're not taking your content away. We're just streamlining. Yeah.
I'll remove the older naloxone leave behind training.
And is there any additional discussion on creating a work group to maintain this list and do some of this work outside of this meeting? Okay, with no additional discussion, I will move to a vote. All in favor of forming a work group to update and create material as needed.
Right? No, only if you're going to do something new.
Oh.
This allows you if you want to take one of those two or.
I thought you wanted a work group for this.
The 3-year or any of the.
Oh, I see what you're saying. Okay, never mind.
This is the standing
I read
item.
it too quickly.
Standing item.
I thought you were making a new work group.
Nope.
Okay, never mind. All right. The next one, item G, will be discuss, amend, and approve a work group for pediatric airway training. Do I have a motion to discuss this one?
So moved.
Seconded.
Thank you. This request came from,
This came from PACES.
Yeah.
There was a request from PACES. Is this committee interested in developing some type of training specific to pediatric airway management? I know that there are certain pediatric centers throughout the state that have developed really nice training for EMS on pediatric airway management. So if this group were to develop it, I don't think they'd have to start from scratch. But that was the request from PACES. Again, tried to kind of bring those requests to this group.
Want to add anything, Dr. Ziegler?
No, it does. Thank you. So I'm a member of PACES and we brought this up. No, mainly just there's always a lot of talk about pediatric airways and, you know, advanced airways versus basic airways and supraglottics. And I thought that it would be great if the education committee partnered with PACES and we put together some training.
any additional discussion on this topic? Okay, there's no additional discussion. I'll go ahead and move to a vote on this one as well. All in favor of forming a work group with PACES to develop a training for pediatric airways? Say aye.
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 Are there any opposed? They may. And any abstention? All right, motion passes. If anyone is interested from this committee, and I'm sure we'll extend this to PACES as well, to be a part of that work group, you can send your information to Shelley and we'll work on putting together a couple of meeting times to start working on that material. The last item here on the agenda, item H, discuss grand ambulance rulemaking and next steps. This is another one for Chief Christie.
Thank you. This is the point of the day where I start to get tired of hearing my own voice, and I'm so sorry for everyone that's already sat through some of these sessions. But going to slide 23, we wanted to make sure that we're sharing with all of our committee members information about the ground ambulance rulemaking that is being conducted right now in the state. This is one of the top priorities for the department. And right now we are in the informal phase of the rulemaking for ground ambulances, and we are seeking public comment, both through regional listening sessions and online surveys. I wanted to make sure we're sharing info about the remaining listening sessions and giving everyone an opportunity to be able to provide comment through the remaining parts of the rulemaking. And to round out, we're sharing the timeline and next steps with everybody. So the next slide goes over some of the remaining rulemaking listening session. Our remaining listening session this week is the Southeastern region tomorrow. We will be down at Tucson, and the virtual link is provided here on this slide. We have several drafts that are posted on the website currently. We've had work groups that have been meeting since 2020 on the ground ambulance rulemaking, and the most recent drafts that have been posted for comment are Article 12. Those are our time frame for processing licensing and registration applications, and then the ARCR. Both have online surveys attached to them. All of the feedback that we get through listening sessions, work groups, and online surveys will be incorporated into the next drafts that we intend to post at the end of July, and we'll be again seeking more comments during the month of August. Next slide. A summary of proposed changes is listed here. We want to make sure that we are outlining that all of the changes the department is entertaining right now really are focused on patient care and intended to align with House Bill 2609, which says that the department must adopt rules that focus on patient care as the foundation for all decision making when it comes to ground ambulances. Our rulemaking is again going to align with House Bill 2609 CON requirements that are effective January 1st, 2024. It also defines the new GPS device requirements that is outlined in the bill and must be installed in every ambulance as of January. Next, we're intending to streamline online applications and payment processes. This group talked a little bit about image trend today, and implementing the image trend EMS and trauma online portal was a big step towards it. We will now, as we move towards January, have a system that will allow all providers to log in and submit all of their ambulance related applications and submit payments as well through that online portal. We are clarifying ground ambulance service contracts, rates, and charges. There is a whole section of the rule dedicated to this. It is Article 11. We're also seeking to outline interfacility transport and critical care requirements. This is an exciting venture for the state. It's the first time we will be able to define critical care as a level of service, and it really is an opportunity to open the door on being able to build a new foundation for that level of care in the state. We will be able to look at being able to build on that as we look at our certification and training rules. We will also be able to build on it and set rates for critical care moving forward. Next, we are establishing statewide response time and dispatching standards based on evidence-based practices. And we don't want to talk about response times without also talking about dispatching standards and things that really are in the best interest of our patients moving forward. We are recommending response time benchmarks based on the 90th percentile for what statute refers to as urban, suburban, rural, and wilderness areas. And I have a slide on that to share with you all with some proposed maps for those geographic areas. And finally, we are standardizing existing performance improvement reporting requirements to measure outcomes and improve patient care moving forward. We're really fortunate in our state because we already have 170 EMS agencies across the state that report data to our EMS registry. And this rulemaking is an opportunity to really standardize that data reporting moving forward and continue to be able to use that information to make recommendations to improve patient care. The next slides I will go through very quickly. We wanted to let everybody know that we have a proposed interactive map available as well as the map data layers available for consumption. I feel like I sound extra smart when I say things like data layers and shape files. And I don't know what that means, but I know you all have really smart GIS folks that have been asking us for it. So we are providing the links for anybody that is interested in consuming those map layers. The next slide we have is the timeline. If there are any rulemaking questions, you can always reach out to me, and you can always reach out to our rule writers. You all know Ruth Ann, especially the folks on the work group that have worked with her for several years now. The next steps in our timeline are displayed here. On July 31st, that's our goal for posting the next draft for additional comments. On August 25th, we are tentatively planning to file what's called a notice of proposed rulemaking. That kicks off another 30-day comment period, and that moves us into the formal comment period, if you will. By October 16th, we are tentatively planning to hold an oral proceeding, and October 24th is our deadline to get what's called a notice of final rulemaking to the Governor's Regulatory Review Council. Something I want to point out is as we move towards that formal rulemaking phase where we submit notices to the Governor's Regulatory Review Council, we also submit an economic impact statement. And I point that out because as we do this rulemaking, our goal is to minimize the economic impact to all providers across the state. Our primary focus is patient care and moving the needle as much as we can to improve patient care. But while we do that, we always want to reduce any administrative burden and economic impact to providers. And so that's an important part of the process. The reason we have to get everything submitted by October 24th is because that Governor's Regulatory Review Council, also called GERC, meets on November 28th and December 5th. Those meetings are public and pre-arranged, and then need all those materials in October to get prepared for that. Once the council reviews and if they approve the rules package, it would go into effect in January. And the reason, again, we are aiming for January 1st is because we have House Bill 2609, the new requirements for ground ambulance in law that will go into effect January 1st. So that is our timeline. We really want to make sure, again, that we're sharing information with you all, our council members. We really are intending to develop a collaborative approach to this rulemaking, and have really appreciated all the feedback we've gotten so far through all of the regional listening sessions and work groups. And I don't think we intend to make this a full-blown rules meeting, but really wanted to open it up if there are any questions, comments. We'll be available during this meeting and after if folks have any questions or comments on rules.
Is there, other than that the legislature hasn't adjourned yet, is there any reason I think it's HB 2711, you're not including in this rulemaking because that has the same effective date in it of January 1st. And it seems like, you know, like if you don't take care of that now, you're just gonna have to open them back up. And I think it got expedited or it's in rulemaking authorization. So, but is there a reason just not to go ahead and address that with this package now, since it's gonna have the same effective date?
It's a great question. Are you talking about Senate Bill 1711?
17, yeah. Something like that.
We do, although it's not specifically referenced in the slide, we do have an opportunity to be able to address some of those very similar items that have the same effective date. In fact, I didn't go over the slides, but nearly every EMS bill this session has the same effective date of January 1st. We do have exempt rulemaking for some of the other bills that will allow us moving forward to also look at January certification and training rules. And that will be something that we will come back and talk with many of you about as we look at the next steps of reviewing certification and training rules to align with some of those other bills. But we're trying, Brian. We're trying to get it out.
It's pretty straightforward on what it says, what seems like. But it's not going to be in the next proposed set of rules then.
Are you referring specifically to EMR drivers, ambulance
Yeah,
drivers?
that's, and, I think it also in I'm not in that kind of business so much, but there requires specialty training for nurses and to be able to do some of that, and this does away with that requirement in certain situations also, and it's the EMR thing with it also.
Yes. Because we do have the ability to do exempt rulemaking come January when that specific bill goes into effect. We are intending to align with that time frame of being able to open up then. I'm sure we will be having discussions as we move closer towards the end of the year on what that process looks like to make sure that we have folks engaged on looking at the certification and training rules. We, as I think Brian knows this better than anyone, but we do have to seek approval even for exempt rulemaking and make sure that we are prepared to ready, set, go. And as we get those approvals in place, we'll be coming back and talking with you all about what those next steps look like for those certification and training rules.
All right, thank you, Peter. And with that, that concludes the end of our discussion and action items. The next item on the agenda is other agenda items to be considered for the next meeting. If you have those, feel free to send those to Shelley. And 7 will be called for the public. And item 8 is upcoming events. There are a list here that you can see here as well as on the DHS website through October. It looks like we have events coming up through August through October on here. Our next meeting will be November 16th, same time. And with that, we can adjourn the meeting. Thank you all.
Thank you.
Thank you.